Today, I'd like to talk about the new visco-free injector. The photo on the center indicates the empty and the flat chamber. The left one is the anterior chamber and the capsular bag formed with viscoelastic material. And the right one is only with BSS. The capsular bag is formed more deeply and uniformly with BSS. Now I will show you the surgery. After cortical aspiration, I change the irrigation line onto the injector. The silicone IOL is preloaded inside the injector. The capsular bag is formed deeply with irrigation. Then I push the rod forward. The IOL goes into the bag smoothly. You can finish the surgery without removing the viscous material. That's all. In conventional surgery using a viscous material, we must do many procedures. However, with this visco-free injector, we can simplify the surgery. With this visco-free preload injector, we can perform the safe and the simple and economical surgery, and also we can avoid the postoperative pressure rise in glaucoma patients. Thank you for your attention.
Thank you very much. The next paper is from Dr. Vyas from UK, a new injector and conventional design hydrophilic IOL for micro-incision cataract surgery.
Good afternoon, everyone. I'm going to talk about a new injector which allows you to implant a conventional design lens following micro-incision cataract surgery through a 2.2 millimeter incision. The design of the injector is such that it's a single piece disposable, and the key thing is it has got a soft plunger tip which is made up of a thermoplastic material. It fills the lumen of the nozzle completely and avoids any overlight. And the main thing is that the lens is then propelled forwards by the hydraulic piston action which is generated by the viscoelastic within the nozzle. And the conventional lens design which we studied for this is the hydrophilic single piece lens with a 12 millimeter loop span and 5.75 millimeter of the optic. Is equibiconvex and is a single plane design. Uniquely, it has the anti-vaulting haptic design as here, which resists the capsular contraction forces. Also, this is the first lens which provided us with a 360-degree enhanced edge to reduce the PCO. We studied 70 eyes following MICS through 1.4 millimeter incision and then stretching the wound size to, extending the wound size to 2.2 millimeter and then implanting the lens with this injector. We did not find any difficulty in implanting this lens through 2.2 millimeter, and there was no damage to the lens optic or haptic that could be observed. There were no shavings from the injector. As you can see here, it's a bimanual microphaco surgery or MICS through 1.4 millimeter. Then you extend the wound just before putting the lens in to 2.2, and you don't have to enter the anterior chamber with this injector. The tip is just docked within the wound. And then you can implant the lens quite nicely straight into the bag. But it's a two-step procedure. You have to still put the trailing haptic in the bag, which is not very difficult with this kind of design of the haptic, as you can see here. So in conclusion, this new design of the injector now offers a conventional, uncompromised design of the lens to be implanted with all its design advantages through a 2.2 millimeter incision following MICS, which then allows you to do the surgery with all its fluidics and wound advantages. So it's a nice combination. Thank you very much.
Thank you very much. The next talk is by Dr. Amselak. He will talk about his first 100 cases of the Acrosert preloaded injector to implant the Acrosoft IQ.
Thank you, Mr. Chairman. I'm going to present my